Benign prostatic hyperplasia is a medical condition in which there is non-cancerous enlargement of prostate gland. If we talk about its etiology, its exact etiology is unknown, but increasing age, family history, obesity are risk factor. If we talk about its pathogenesis, as we know that prostate gland is capsulated and there are three zones. Within the center of transitional zone, a urethra passes. In prostatic hyperplasia, the number of epithelial and fibromuscular cells increases in the periurethral zones. These increasing number with the passage of time start compressing the urethra and result into lower urinary tract obstructions, and patient present with lower urinary tract signs and symptoms. If we talk about its clinics, urgency means strong desire of urination, increased frequency mean increased number of voiding, dysuria painful urination, hesitancy means difficulty to initiate the urination, post voiding dribbling mean dribbling after micturition, increased residual volume mean incomplete emptying of bladder. Complications of benign prostatic hyperplasia include acute urinary retention, means sudden retention of urine, hematuria means RBCs in the urine, and there may be urinary tract infection. It may be cystitis and pyelonephritis. Cystitis means inflammation of bladder and pyelonephritis means inflammation of kidney. There may be bladder stone. Bladder stone is due to urinary retention. When there is urinary retention for a long time, it results into precipitation of solute into the bladder. There may be kidney or bladder damage. We can diagnose benign prostatic hyperplasia by digital rectal examination. In this procedure, first finger is introduced into the rectum of a patient and the prostate gland is palpated. Benign prostatic hyperplasia will show us that there is enlargement of prostate gland, but it will be inelastic and uniform in the consistency. Then urinalysis can be performed to differentiate it from urinary tract infection or acute prostatitis. Serum prostatic specific antigen can be checked. Normally, prostate gland produce serine protease, which play important role in the liquefaction of semen in the female vagina. And small amount of serine proteases diffuse from stroma of prostate gland into blood vessels, and we called it prostate specific antigen. Its normal level in serum is 4 nanogram per deciliter. If its level increases more than 4 nanogram per deciliter, it means there is overgrowth of prostate gland. Then we will differentiate benign prostatic hyperplasia from cancer of prostate by taking and studying the biopsy of prostate gland. If the condition is complicated, cystoscopy can be performed. Is a procedure in which endoscope is introduced into the patient bladder through urethra and internal structure of bladder is examined. Then ultrasonography of prostate gland can be performed. Micturating cystourethrogram and intravenous pyelogram can be performed, but if the condition is severe. Medical treatment of BPH include alpha-1 adrenergic antagonists such as tamsulosin, parazosin, and 5-alpha reductase inhibitors. Alpha-1 adrenergic antagonists inhibit the action of adrenergic neurotransmitters at alpha-1 receptors of smooth muscles of prostate gland and urethra and relax the smooth muscle, result into urinary outflow. 5-alpha reductase inhibitor inhibit the action of 5-alpha reductase enzyme that play important role in conversion of testosterone into dihydrotestosterone. Dihydrotestosterone is active form of testosterone and play important role in the growth of prostate gland. When there is inhibition of conversion of testosterone to dihydrotestosterone, the growth of prostate gland will be inhibited, and with the passage of time, after a long time, the prostate gland will be shrinked. Surgical treatment of benign prostatic hyperplasia include transurethral resection of prostate. In this procedure, small part of prostate gland is resected through urethra. In transurethral incision of prostate gland, small 2 or 3 incisions are made in the prostate gland through urethra. And last option is prostatectomy, complete removal of prostate gland. It may be open and closed. Thanks for watching this video.